Hello everyone, I'm Dave, and this is Chemotherapy Part 2. This is a series about my experience with chemotherapy and my perceptions of what's happening to me. Hopefully I can give you some insight into what might happen to you or what the experience might be like for other people. Today I'm going to talk about medications. I've gone through one cycle of chemotherapy now, and I'm getting used to some of my medications. I know some of the names, I know what they do, so I can speak more intelligently about what's going to happen. Previously I gave my impressions of what the medications sounded like to me. I had this paper I talked about. My doctor wrote this out by hand for me to explain what some of the medications were and what the side effects would be. I now have an updated paper. This one here replaced that other one. So this is a list printed by the pharmacy at the hospital. These are instructions on how to use the medications. This is when I take the medications, and these are the names of them. The course of treatment I'm on is called RVD, which, as I understand it, about half of multiple myeloma patients are on the RVD treatment. RVD stands for the three main chemotherapy drugs: Revlimid, Velcade, and dexamethasone. Revlimid and Velcade are the main chemo drugs. Dexamethasone is a steroid. I'm not exactly sure why that's so important. I think it's a catalyst. It helps the others work better. Apparently it's an important part of it. These two drugs here and the one on the next page are to manage the symptoms that I have from these three. I'm also on some other medications for pain. I have a pain oncologist who's trying to help me become more functional with the pain that I have, mostly in my hips and back. I'd like to go down this list and talk about these things independently so that you can get a better idea of what might happen. The first drug on the list is dexamethasone, and this is the steroid that I'm taking. Previously, I said I had a problem with steroids. When I was on steroids, I got very angry. It interfered with my thinking. I was always upset, and it made it hard to function. Really, it was just I was constantly unhappy because I was so angry and I couldn't control it. The course of steroids I'm on right now, for whatever reason, is not affecting me that way. They give me a lot of energy, and that's a normal side effect. I only take the dexamethasone once a week. It's on the day that I take Velcade as well. I have to go in for my infusion. The day that I take it, I usually don't sleep that night. I take it as early in the morning as possible. When the night comes around, I still have so much energy. Sometimes my heart beats kind of fast, and usually by the time I go to sleep, I still have so much energy that I can't sleep. I get a few hours of sleep now that I'm getting more used to it. I've taken dexamethasone 4 times now, 4 different weeks. I'm starting to get used to it. It's getting better. The next couple days after I take the dexamethasone, I also have quite a lot of energy. Often after that, I crash. So 3 or 4 days after, I have a crash, and the doctors tell me that's normal. And it's because steroids, they give you a lot of energy, and when that energy falls off, you feel a crash even though you're just returning to normal, I guess. After that is more like what my normal life is without the dexamethasone, but with the drugs that I'm on at the moment. It's really not bad. I was worried about it. The doctors keep asking me because they knew my concerns. I feel like it's okay. I told them you can actually increase it a little bit if it helps my cancer situation. This is all about stopping the cancer, so it needs to happen. But they seem to think it's in the right place, and they said they might even lower it in the future. So that's good news about dexamethasone. The next drug on my list is Velcade. Velcade is the one that I go into the hospital for the infusion. From what I understand, usually people will be sitting there by a machine, as I described previously, with a line plugged into their arm, having the Velcade pumped into their system. There's another way to get Velcade, which is subcutaneous. They just put a needle into your stomach. It doesn't go into your stomach. It's into the skin of your belly, just under the skin. It's actually like a needle you would get a shot, like a shot. But the pokey part of the needle part is very small. It's a pinch going in. It's not too bad, but there's a lot of fluid in the needle, so they have to push it for a long time. And usually the nurse who's doing it is talking to me while it's happening, and it takes a couple minutes. She's pushing it in very slow. And I think that's because they don't want a bubble to form under my skin, a bubble of fluid. It's absorbing in. They go a different spot every time. They go left and right, and they switch back and forth. It does cause bruising and a red spot. The first time I had some skin peeling away. It's like a light sunburn kind of skin, not a whole lot of skin, not scary like. I'm getting marks on my belly. They're not going away so quickly. The doctors tell me they will go away eventually. They seem to be kind of not so sure about that, like maybe possibly there might be discoloration. I don't really care. I was just curious if it would go away. It's not like it's going to damage my modeling career or anything. I don't know much about what Velcade is doing to me. I don't know much about the side effects that I might be feeling from it. Revlimid is the big expensive drug that makes you cry. It's very technical getting this one. This is the one I have to have phone calls with a pharmacy that's in Oklahoma, and there's things going back and forth, and my doctors have to do things to make it happen. People have to make calls to send this stuff to me. I get the feeling this is the big bad drug. Previously, I had said what I'm doing is like chemotherapy, but not actually chemotherapy. But as it turns out, it is chemotherapy. Revlimid comes in this bag. Caution, chemotherapy drug. You can see the biohazard symbol there. Yeah, it's really chemo. The Revlimid seems to be the main drug. They tell me this is the one I'll probably stay on long term to prevent cancer from returning if we can get it under control now. It will be a lower dose, but it will still be Revlimid. Something interesting about Revlimid is that Revlimid, they call it a second generation drug. It's very targeted. It goes right to the fast reproducing cells and attacks them. Because it's a second generation chemotherapy drug, I don't lose my hair, I don't get skinny, I don't lose my appetite. It's actually not that bad. This is a good time to talk about side effects. The Revlimid is the one that has the strongest effect on me, as far as I can tell. The side effects that I experience are not that extreme. The doctors tell me that this is because I'm very young for cancer, and I'm very healthy. They say that all the time. I just eat well. I eat a lot of vegetables and things. They tell me that I'm not experiencing many of the side effects very strongly, and I'm really glad. Unfortunately, that means I can't give you more insight into the experience that might happen to you, but my personal experience is that there's a lot of dopiness. Dopiness is the biggest problem, and I'm always talking about it. I can't think straight. It's kind of a fog. It's like being drunk. At first, it was kind of fun. I was like, yeah, if this is it, I can handle this. I can just be chill all the time. But it stops you from functioning at any kind of level other than just being. And I do want to keep doing things. I do want to keep having a life. I don't want to just stop and do chemo. So the dopiness was a problem. More in the beginning. It's getting better now. The dopiness can be caused by my cancer. It's part of the fatigue thing I'm talking about now. The fatigue and the dopiness kind of feel like they go together. Now let me focus on the dopiness. The dopiness can be caused by many of the drugs that I'm on right now. So it's hard to say that it's actually Revlimid. It could be Velcade. It could be an effect of the steroids wearing off or coming on. There's a lot of things that it could be happening there. It is manageable. And even if I couldn't get rid of it, I would be okay. It's not a game changer. It's just, I wish it wasn't happening. Now, after the first month, it really is under control. Another side effect is fatigue. And unfortunately, the type of cancer I have, multiple myeloma, causes fatigue. The radiation treatments I got cause fatigue. The drugs that I'm on cause fatigue. The painkillers I'm on cause fatigue. There's all of these different things are causing fatigue at the same time, and it's a really big limitation in what I do from day to day. For example, when I get up, I don't really have energy to start, and I know everybody has that feeling, but there's not that fire to move, take charge, and do. When you get up in the morning and you're tired, there's some personal motivation in there that drives you out the door. I've got to go do things. And that's not there. It's like you're just kind of in a fog. I can get up, I can get myself breakfast, I can take all my medications, and then I need to sit down again because I'm already at my limit at that point. It used to be that I had to lay back down in bed and take another couple hours or so to get up. Now I can sit down and I can do some things on my computer or things on my phone. It's not like higher order functioning. It's just checking emails and stuff like that. Things are getting better most of the day. Fatigue doesn't bother me too much. By the time it's about 6 p.m., I don't have energy to do more. I'm back to that place. I only get about 8 hours total of full function in a day, which is really good compared to where I used to be. In the beginning, it was 0. When you only have 8 hours of full function, that's not that I can have 8 hours of work. I still have other things I have to do. It's an issue. On top of that, the fatigue limits pretty much everything you try to do above and beyond just moving around the house. So if I go outside, if I go somewhere, if I go shopping, if I walk for more than a few miles, that's it. I hit a wall. And the fatigue's got me. If I do push myself too hard, I'll pay for it in the future. After a day or two of pushing hard, I'm down like a full day in bed and you just can't get up. There's no energy at all. So the fatigue is a big deal. On to the other medications. I'm also on a Aciclovir. Aciclovir is to stop shingles or chickenpox or herpes from having an outbreak. Apparently some of the medications that I'm on will cause these things to come out. Like if you had chickenpox as a kid, it's still in there, and some of these drugs can make the chickenpox happen again. So the Aciclovir stops that. The next medication on the list is Eliquis, and Eliquis is the one that stops blood clots. I mentioned previously that there's a danger that some of these drugs could cause blood clots in my system, and then you have a stroke or a heart attack. That one I do know has caused some bruising, but not too bad. Every time I go in for a treatment, they give me a blood draw. I switch arms each time so that it's not too bad. I don't usually bruise when I get those blood draws, and now I do. That's the only side effect I've had from that. It's not too bad. The last one on the list is Prilosec, which I think is actually a brand name. And that one's to stop heartburn, acid reflux, and things like that. So I haven't noticed many side effects from lots of these drugs. I did learn something I didn't know before. Previously, I had said that I would be susceptible to all diseases. That's actually true in a later stage when I do the bone marrow transplant. For now, I'm only susceptible to upper respiratory tract infections, which are like colds and pneumonia and unfortunately COVID. So anything that can get in your upper lungs. I asked the doctor about this. I said, do I really have to be not around people, like if I think my friends don't have a cold or what? The doctor said, the truth is, if you just wear a mask in public and when you're around people you know, if you ask them if they're okay, if they're not the kind of people who get exposed to a lot of other people so that they don't have COVID, you're probably going to be okay. COVID really is the problem because people can have it without knowing it. The other ones, people generally know if they're sick. A month into my chemotherapy experience, this is my perception of the medications that I'm on right now. I will be on these same medications for several more months, but they may change in the future. And if I have more information on them or more perceptions of my experience with them, I'll update you. Thank you for watching and farewell.